On one very important level, health innovations continue to improve and even save lives. No one can discount how important these innovations can be. On another metric, state policymakers are interested in the economic development side of innovative health companies. The companies provide jobs, often jobs that are higher paying than the average job in a state, and the income from these jobs has considerable ripple effect throughout a state's economy. Silicon Valley, the Research Triangle in North Carolina, and the high-tech corridors around major cities are the envy of many states. While no one expects to become a second Research Triangle overnight, policymakers want to know what they can do to encourage such development in their states. Today we will pose that question to three people who are intricately involved in the decision-making process of high-tech healthcare companies. In preparing for this discussion, I asked our speakers to provide insight into how their organizations think about investment decisions and how state policies can influence those decisions. Our listeners today have a chance to ask questions of the speakers. You can type your question directly into the box in the GoToMeeting control panel on the right-hand side of your screen. Or if you prefer, you may simply email your question directly to us, addressing it to questions@csg.org. Our first speaker today is Peter Pellerito, Vice President for State Government Relations and Alliance Development for Biotechnology Industry Organization, BIO for short. BIO represents more than 1,000 biotechnology companies, academic institutions, state biotech centers, and related organizations across the United States, as well as in 30 or more nations. He has served as a consultant to BIO since 1995 and has written and contributed extensively to numerous bioscience economic policy publications. His experience also includes senior government relations posts at the University of Michigan, so he knows firsthand the idea of state policies and attracting companies to the state. Peter, we're going to turn it over to you.
Thank you very much, Deborah. Actually, I'm calling in from the Research Triangle Park in North Carolina on a visit. And I'm very pleased to be on the webinar with you to discuss ways states, region, and even cities are pursuing bioscience industry growth and the jobs and companies that come from commercializing great science. What I'd like to do in the time allotted to me is provide you some sense of the size and diversity of the industry and some of the vital building blocks and strategies that are creating a continuing climate for bioscience job creation, even in this challenging economic environment. The comments I will briefly share with you this afternoon are really the culmination and accumulation of a decade's worth of work by the Biotechnology Industry Organization, the Battelle Memorial Institute of Columbus, Ohio, and others to better define this growing industry and identify ways that partners in industry, policy, and research in the states are moving innovation forward and creating new models for growth. As Deborah mentioned, I have been involved in the biotech and biosciences industry for more than 30 years, actually, starting with my work at the University of Michigan in Ann Arbor, and now multiple studies and outreach efforts on behalf of 1,100 companies that comprise the membership of the Biotechnology Industry Organization. My comments are going to be in two parts this afternoon. First, a current snapshot of the industry nationally and some partnership strategies that may assist you as public officials in your efforts to be a growing member of the national bioscience research and commercialization community. If we could come to the next slide. Thank you. First of all, whether we call ourselves biotech, biosciences, or life science companies, the industry science base and commercializations are very diverse and linked by the application of knowledge in the ways plants, animals, and humans function. We create products and services that produce knowledge and commercialize that knowledge for a growing not only U.S. market, but a growing world market. Next slide. Thank you. Well, this is working out wonderfully, Deborah. We are, of course, agricultural feedstock provides food for our citizens. Drugs and pharmaceuticals, of which is the focus of our attention today, by and large, keeps us healthy and productive. Medical devices, also a part of our presentation today, provide a whole variety of ways to improve the delivery of drugs and diagnostics, and research, testing, and medical laboratories augment primary research aimed again at commercialization. Next slide. As you will note in the next three charts, real earnings for workers in this industry have actually grown. We are more than 47,000 companies and 1.4 million workers. These are absolute increases of 28.3% in the number of establishments and 15.8% increase in the number of employees, respectively, from 2001 until the 2008 timeframe. I should also mention that we have just received some information from Battelle. All sectors of the economy, of course, have suffered during the recession, but our sector, our technology sector, probably suffered least among any of the technology sectors. We actually think we grew by about 1.9% in 2009, and we're going to have those numbers a little bit later, and we'd be happy to share that with all those on the phone and certainly with Deborah and colleagues. Next slide. Also note on this slide that the overall industry outpaced national employment growth in all four of the sectors that I mentioned earlier, with research, test, and testing companies leading the way. Again, a pretty good indicator that over time our industry absolutely continues to grow. Next slide. All 50 states, the District of Columbia, and Puerto Rico are investing in the biosciences. These 1.4 million people I was mentioning earlier who work in this industry averaged more than $77,000 in 2008. This is appreciably higher than the national average of $45,000 for all private industries in the U.S. In that same year, 2008. As you can see, drugs and pharmaceuticals led the way with 93,000 per employee. Research and testing, 80. Again, the average biosciences, 77.5. Agriculture, feedstock, and chemicals, I mean, that's not the focus necessarily of our conversation today, but certainly is part of what we consider our general industry, 72,000. And medical device companies, 63. And these are all really substantial numbers, all very good, I think, for the general economy, all present in every state, the District of Columbia and Puerto Rico to some degree or another. Next slide. So really, why are we important as an industry to state economies? Well, first, we do add to the durable goods manufacturing sector of the economy an environment of increasing and sustained international competition. We know that. And we're very cognizant of that. Public officials, governors, as you know, you as legislators and others interested in this conversation have been reading almost daily on either the internet or in newspapers the challenges we're having in international competition. Second, as mentioned before, these are good jobs that diversify the economy and support the creation of improved standard of living, and that in turn for states supports taxes, that in turn support education, public policy, and other budget priorities. And third, for many states, the industry is intertwined with technology transfer efforts by universities, workforce development at community colleges, and the inflow of federal research funds to public and private research organizations, all cumulatively impacting in a positive way the opportunities in every state, because every state has universities involved in tech transfer, workforce development, the community colleges, and federal money coming into research organizations. Next slide, please. We have been working with state government and other support organizations for almost 2 decades and have found that there to be several fundamental building blocks for bioscience companies, large and small, testing and producing, that need to be in place for a state to attract, retain, and enlarge company operations. They are capital formation funds for small and innovative companies, technology development stemming from university research and discovery, facilities and other infrastructure needs that require attention, and qualified personnel ranging from PhDs and master's degrees to QA, QC technicians and manufacturing specialists with associate's degrees. Next. Let's start with some of the main building blocks. I'm actually going to, what you see in front of you are some main points, but I'm going to give you some examples here of some states, and I guess I should have mentioned that I will have my comments available for those interested who would want to give your email address, and we would certainly forward the examples that I'm going to be talking to you about here in the next few minutes. As it relates to capital formation options, a significant number of state governments over the past 10 years have legislatively endorsed measures to proactively promote the formation of venture capital and discovery funds that benefit targeted technology sectors, especially early stages that are underserved by existing capital markets. Understanding that if they are to effectively compete to create and retain our sector and technology in general, states have actually modified their supportive investment structures to more accurately reflect the changing nature of the industry and competitive funding techniques. For example, I have 3 or 4 examples here. Maryland's Biotechnology Investment Tax Credit Program provides income tax credits for individuals, corporations, and qualified Maryland venture capital firms that invest in qualified Maryland biotechnology companies. The value of the credit is equal to 50% of an eligible investment made to a qualified Maryland company during a taxable year. The maximum amount of the credit cannot exceed $50,000 for individual investors and $250,000 for corporations and qualified Maryland venture capital funds. Missouri's new enterprise creation tax credit through their Department of Economic Development offers a multi-million-dollar pool of 100% tax credits to individuals and corporate investors in venture funds that are approved by the state statutory Missouri Seed Capital Investment Board. The board, in turn, has selected a venture company as sole eligible investor to actually administrate the program. The Kentucky Investment Fund Act in place today provides a 40% tax credit capped at $3 million a year and is available to certain personal and corporate investors in approved venture funds. They must invest in qualified companies in which are Kentucky-based small businesses, half of whose assets are in the state with net worth of less than $5 million or net income less than $3 million and less than 100 employees. And finally, in the capital formation options, the last example I want to present is Oklahoma's CAPCO Tax Credit Act, which has received quite a bit of national attention over the last couple of years, because rather than direct or indirect investment of appropriated funds, it uses tax credits as levers to increase the level of indigenous capital that is invested in-state in various kinds of target enterprises. I think the take-home message as it relates to the building blocks, number one is small companies are very valuable long-term to the value of the state's economy, but they certainly are looking to state government and others to help them provide the basic infrastructure and some basic tools in venture funding to support their, what I consider very important valley of death options coming before them. And if we could get to the next slide, I'll show you. For those of you who have been on a committee related to economic development, technology, venture capital, and I'm sure you're aware of this chart, but it is a fairly simple graphic that depicts what technology companies call the valley of death in product testing. Making a biologic or a medical device discovery in a lab is one thing. Delivering new treatments to patients at a profit is another. Cash-strapped bioscience companies whose mandate is to bridge this gap between research and products call it, again, the valley of death because so many quality companies wilt under the cost of producing a product. The examples of state efforts that I've mentioned just now aim to assist their in-state companies as a second point to withstand the funding challenges and get to the other side of the valley. Next, please. Building block 2. Well, there must be something going on there. Sorry, I'll make sure that we put something in there. But the second slide, of course, is moving technology forward into commercial products and services. State and local governments concerns with regional economic growth have increasingly focused attention on technology transfer as a mechanism to increase private sector innovation-related activities within their jurisdiction. Realizing entrepreneurship is a key ingredient in economic development, states and localities are undertaking the supportive programs that assist high technology businesses and that capitalize on state and regional presence of universities and federal laboratories. 22 states now support programs that provide commercial assistance to technology companies in an effort to more smoothly transition invention into innovation into the marketplace. And here are some two or three examples. The state of Washington has earmarked a portion of its tobacco settlement money to fund bioscience R&D through the $350 million Life Sciences Discovery Fund. And when in 2006 it began allocating millions of dollars annually to research projects with economic development potential, including recruitment and facility enhancement. Even as of last year, the state projected that this would leverage $1 billion in additional external research funding over a 10-year lifetime and create at least 10,000 jobs within 15 years. Connect, which is an old and established company or activity in San Diego, is designed to link entrepreneurs with critical resources for success, provides networking opportunities. Again, another way to get entrepreneurs together with venture funders and policymakers. These networking opportunities bring together the expertise of all of San Diego's technology-based firms to some degree or other at some certain time or another. Through the use of partnerships with the region's industry-specific organization and key individuals, Connect has assisted entrepreneurs and bioscience companies commercialize ideas, patents, and other opportunities surrounding university and private research efforts. This is an older program, but still very successful, and as I'm sure you all know, or most of you know, the San Diego area is clearly one of the strong and vibrant life sciences clusters in the country. Texas. The Texas Emerging Technology Fund was created in an effort to speed up the process of commercializing within their state and create jobs, et cetera. The fund is designed to boost eligible industries that will lead to the creation of jobs and or medical science breakthroughs that, of course, include us. I think one of the interesting things about the Texas fund is that 1/4 of the fund is dedicated to recruiting sought-after top research talent to the state, along with their team patents, and portfolio of potential emerging technologies. Another quarter of the fund is used as matching grants to help draw down federal dollars or capitalize on federal dollars and help push technology through the commercialization process. The last one in this moving technology forward, of course, and similar in some respects to what Texas is doing with their Emerging Technology Fund, is the Georgia Research Alliance Eminent Scholars Program, which was created by business and university leadership to attract the world's preeminent scientists to Georgia's universities to lead programs in research and development in areas with the most potential for generating high-value companies, helping established companies grow and creating, of course, as we all know, more and exciting jobs. Next slide. So before don't go off the slide yet. Well, keep it right there. There is. I will want to note here that when I first started working in government relations at the University of Michigan, the discussion of technology transfer was certainly on the minds, I think, of the business community, universities in general, and certainly in Ann Arbor, in all deference to members of the legislature who may be on the line today. Probably at that point in time, there was a seeming disconnect. But I think more and more university leadership, both public and private universities, are clearly understanding that it is also in their vested interest to work more closely with policymakers and with industry to find ways to make their discovery activities coming from NIH funding in particular become valuable to the overall economy, not only in the country, but certainly in their state. And I think that's reflected in some of the new trends happening now, and I know that's what we're going to be seeing here in the future. Next slide. Workforce. Those states that possess a high-quality labor pool are attractive to our industry. In this global economy, nearly every competitor has access to breakthroughs in technology and to the equipment and the capital to produce standardized products. But those regions that possess the human capital with its insights, competencies, and experience have a competitive edge. I'll give you a few examples of some states, again, who we think are doing some really great job in job creation and training credits. Mississippi, for example, offers a credit for the creation of jobs in the context of a new corporate headquarters location as they pursue companies. Arkansas offers a credit to employers for expenses incurred in training a biotechnology or life sciences workforce. The Illinois Department of Community Economic Opportunity has created the Biotechnology Bioscience Training Investment Program to help train graduate students working part-time in biotech positions. It's called BioTip, and it provides grants to companies to help cover training costs for graduate students who find part-time employment as lab technicians or engineers in the biotechnology area and provide essential training to students to enhance their practical skills. In 2009 or 2008, Massachusetts budget passed approximately $750,000 with another $200,000 available to the industry for what is called the BioTeach initiative. This initiative, an innovative program, is designed to provide biotech lab equipment, lab supplies, and recurring teacher training to Massachusetts public schools. Again, the basic message here is that these are quality jobs. States are actually trying to work with industry to find ways to, well, first of all, to find ways in the K-12 system to have young people become interested in science and math, number one, which all of you and all of us have a real primary stake in making sure that that's successful. Second, either bringing in people who are being either retrained or trained for the first time in a particular sector, realizing the value of that. State governments are being very proactive in job training, in particular in our sector, again because of the perception and I think realistically that we are a contributor to the future of the vitality of their state and certainly the country. The next is number 4. Next slide, please. Facilities for growth. An investment in the physical structure, needs of a basic or applied research activity at a university and these institutes is essential and is a step towards creating a productive environment for our industry. Because the industrial applications of the industry have dramatically changed in the past 10 years, state-of-the-art research demands have changed, and therefore the increased demand for modern research facilities. State governments in particular have become aware of this competitive advantage and have integrated the physical facilities into the overall strategy for economic development. This has been accomplished by the legislature setting aside pools of matching physical infrastructure funds to leverage public-private partnerships. Going back to Texas, the legislature there created an exemption from the state and sales use tax on pharmaceutical biotechnology clean rooms and equipment. This is very important for us. The exemption applies to all tangible personal property used in connection with manufacturing, processing, or fabrication of a pharmaceutical biotech product in a clean room environment. Massachusetts recently passed legislation actually to build 3 new industry-related facilities at the University of Massachusetts site in Lowell, Dartmouth, and Boston. The legislation provides funding for the construction, equipment, and operating costs of a new nanotechnology and biomanufacturing facility that has now, I believe, all 3 are now complete or in process, particularly the one in biomanufacturing at the University of Massachusetts Lowell campus. Pennsylvania has, of course, this is a main line and what I would call a success story example. Pennsylvania in 2001 now, this goes back now 10 years, created the Pennsylvania Life Sciences Greenhouse Initiative to sustain early stage risk capital for the industry. The investment of $100 million was allocated to central Pennsylvania, Philadelphia, and Pittsburgh, and is part of the state's larger $2 billion biosciences enterprise commitment. Arizona's Biodesign Institute at Arizona State University was created to create an environmental research culture to attract scientists uniquely capable of working across disciplines and in close cooperation with industry. All examples, again, of the interface between industry, research communities, and policymakers to move technology forward. Next slide, please. Well, so with this information in place, I hope this kind of provides somewhat of a general understanding at this moment. Obviously, we have great speakers following. General understanding of the national field of play that we're involved in, and the strategies by states to pursue this, to either grow this industry, pursue this industry, grow this industry. Here's a couple of thoughts I have in the interim until we get to questions. First, I think it's important that the states who are interested in enlarging the presence of our industry realize that it has taken a long-term perspective and long-term view by a number of states and a number of regions in the country as to the value of this industry. The Research Triangle Park is actually 50 years old, and as I said early in my commentary, I'm actually here today. For the first 20 years, it primarily was in stasis, trying to figure out where it was going to be going as the state's economy was going from agrarian to something, to technology. I think patience and a long-term view is very important to every state interested, either in keeping what they have and those states who want to actually attract the industry. There are actually, because the industry is going to diversify, there's going to be some convergence of technologies. And some of the technologies that I think are going to be valuable to almost every state in this country are diverse, and the resources and the intellectual property and the personnel are in place to help support that. I put together what I consider to be some areas of new potential long-term growth for the next generation of life sciences companies. Bioinformatics, contract information, contract research and manufacturing are very important to us. They don't require, the creation of a multi-large campus to be successful. Nanotechnologies, of course, will be one of our key sectors for growth. And alternative energy, again, although not in the healthcare side, will be very important to us, nutraceuticals, and of course personalized medicine. These in particular are going to be valuable to us, and I think we're going to look back in 10 years and we're going to say, I don't think we could imagine that. Just as 10 years ago we couldn't have thought about the cutting edge research and products on the market today. Okay, I know I've gone over my limit. It's a very large industry, lots of components, lots of folks in the conversation, and I hope this information has first provided you a glimpse, a very short glimpse, into the diverse nature of our industry, the bioscience industry, and what it takes to develop it. And as you look for pathways for sustained economic development in your state, we all are there to support your efforts, because your efforts make our national efforts more successful, particularly as we work in an increasingly competitive international environment. So, Deborah, back to you.
Thank you very much, Peter. I think you've set the stage for our next two speakers who will be talking, moving from the big global picture down to give us more of a picture of their own industries and perhaps even their own company and how decisions are made. Our second speaker is Dr. Christine Greigon. She is the head of Boehringer Ingelheim Partnering in the Business Developing and Licensing Group out of their plant or headquarters or whatever facility in Ridgefield, Connecticut. During the past year, she has also been the acting head of Global Licensing Oncology, where she has oversight for strategy and evaluation around external alliances for BI's oncology portfolio. She is an inventor on 5 patents and an author on more than 23 peer-reviewed scientific publications. Her resume included some other positions she'd had, but honestly, they were so scientific and technical I couldn't reduce them to easy language to read in her bio. She was a 2008 finalist for the Connecticut Technology Council Women of Innovation, Research Innovation, and Leadership Award. So now we'll move on to Christine. Thank you.
Wow, thanks, Deb, for that very kind introduction, and thanks also for the invitation to participate in this event. Thanks to everyone who's on the line. I'm really thrilled to have the opportunity to talk to you today about innovation and specifically what it means to Boehringer Ingelheim. I want to direct my comments today to 2 important concepts around innovation. Number 1, American jobs, and how important it is to continue to embrace innovation in the U.S., not only for our own economic development, but because we have to compete in a global economy. And number 2, the fact that innovation drives medical research, and this is aimed at the important goal of helping patients who suffer from conditions of unmet medical need. So can I have the next slide, please? So first of all, just a little bit about Boehringer and who we are. Boehringer Ingelheim is a 125-year-old family-owned and privately held company. And we're privately owned, so you may not have heard of us before, since we're not publicly traded on the stock market. but we're focused on furthering science to benefit the health of patients and their families. And our privately held status allows us to focus on research and development over the long term. And Pete mentioned this concept a little while ago about the long term. And I think most of you are all aware of the cycle time in the pharmaceutical industry and that years and years of testing are required to ensure the safety and efficacy of a new drug. So when we invest somewhere, we invest completely for the long term. Currently, our R&D efforts are working to address more than 22 chronic conditions, and we have successfully brought 12 major products to the market in the past decade. And we have several more important therapies in our pipeline going forward. Can I have the next slide, please? So Boehringer's world headquarters is actually in Ingelheim, Germany, but we're very, very heavily committed to and invested in the U.S. because of the traditional focus on rewarding innovation here. Connecticut is home to our U.S. headquarters, and it's here that we conduct significant research and development activities for new medicines. We have over 3,500 employees at our site in Connecticut. We have 2 generics facilities in Ohio, and these facilities employ over 2,300 employees. And we also have a chemicals facility in Virginia with 450 employees where we make active pharmaceutical ingredients. We're very proud to have our global animal health headquarters in the U.S. With significant facilities in Missouri and Iowa. And these facilities are home to 1,900 employees. Most recently, and so recently that it's not even showing up on this slide, we actually just closed the transaction on this several weeks ago. But we've also just purchased from Amgen a biopharmaceuticals development and manufacturing facility in Fremont, California. There are over 300 people employed at this site, and we're very excited to now have a presence on the west coast of the U.S. as well. Finally, we have sales and operations teams that are spread throughout the United States for our branded generic and animal health divisions, and this gives us a total of over 9,000 jobs in the U.S. So as you can see, we're continuing to grow, and we do hope to further expand in the near future, and this is a really exciting time for Boehringer. So can I have the next slide, please? We invest in research activities in a number of disease areas, and particularly where there continues to be unmet medical need. I doubt there's anyone listening to this webcast today that isn't personally affected or doesn't know someone who is impacted by at least one of these disease areas. Oncology or cancer and metabolic diseases including diabetes, autoimmune diseases, things like multiple sclerosis, rheumatoid arthritis, CNS or central nervous system disorders, things like Parkinson's and Alzheimer's disease. So we've had a significant commitment over the years and a very substantial investment in research, and this has led to the discovery of potential new treatments to help patients. One area that we're particularly interested in is in the cardiovascular diseases area is the prevention of stroke related to atrial fibrillation or AFib. Atrial fibrillation is associated with up to 20% of strokes in the U.S., and it impacts more than 2.3 million Americans. AFib is associated with a 5-fold increased risk of stroke, and AFib-related strokes are twice as likely to be fatal and twice as likely to be disabling as non-AFib-related strokes. And approximately 60% of the strokes associated with this disease are potentially preventable. So finding innovative solutions to these kind of problems is really important not only for patients who suffer from AFib and their families, but also for society in general, because the costs associated with these serious illnesses, such as stroke, really significantly impact our healthcare system. As another example, in the respiratory diseases area, our commitment to finding innovative solutions to patient needs really extends back more than 20 years. We've been a leader in the development of medicines to manage COPD, or chronic obstructive pulmonary disease. We've also learned, though, that firsthand there really is still a significant lack of awareness about this condition, even though it is the 4th leading cause of death in the U.S. and it affects an estimated 24 million people. So with this in mind, we've launched a public awareness campaign, and the purpose of this is really to educate and provide patients, doctors, and the public with tools and information necessary to better understand COPD. The name of this campaign, we call it Drive for COPD. The campaign is a collaboration between the American Lung Association, the COPD Foundation, and other nonprofit groups. NASCAR is also heavily involved. They're a leading partner, and celebrities such as Danica Patrick, Jim Belushi, Patty Loveless, Michael Strahan, and Bruce Jenner are also supporting this effort. Metabolic diseases, especially diabetes, Boehringer Ingelheim has made a corporate commitment to really exploring this area. The statistics here are just simply staggering. There are about 27 million Americans and 285 million people worldwide suffering from diabetes. And each year, more than 230,000 people in the U.S. and more than 3.9 million people worldwide die from diabetes or its complications. This number is expected to increase by more than 50% over the next decade. Again, the statistics are simply staggering. And this will require significant investment in innovation in order to address the challenges associated with this pending crisis. So in addition to our commitment to respiratory and cardiovascular health, Boehringer is committed also to making advances in other areas such as in oncology. And we hope that research in the near future will bring new medicines to help patients with these conditions. Next slide, please. So I just want to reiterate something that Pete touched on in his presentation, and this is around job creation in the biosciences area. I offer here another statistic to support that. Biopharmaceutical research companies directly employ more than 686,000 people in the U.S. But the ripple effect and another important consideration is that indirectly this industry generates millions of jobs in other industries, and clearly investing in innovation is good for economic development. Our employees are valuable members of their local communities. They support local businesses and infrastructure. They contribute to taxes and to boosting the economies locally. And I just wanted to make one quick brief point about how important protecting intellectual property is to us. And this also relates to the area of job creation. It's important to recognize that industries such as the pharmaceutical industry that rely significantly on IP create more jobs, they pay higher wages, they drive U.S. exports, and they sustain economic growth much better than non-IP intensive industries. And without IP protection, Americans lose out on job opportunities that result from this industry growth. And ultimately, patients lose out on the benefit of future medicines. Next slide, please. So what are we asking of you? You know, the U.S. has a history of rewarding innovation. I mentioned this earlier. We're leaders in R&D for new medicines, and this really allows private industry to expand jobs, create jobs, retain jobs, and it allows the pharmaceutical industry to develop treatments to improve and save lives. But these life-saving medicines don't just happen. U.S. legislators also play a very critical role in ensuring our success by enacting policies and laws that enable innovation and protect IP. So I'm really aware of the difficult challenges that you face in these economic times, especially as you try to address all of your significant budget shortfalls, and I certainly don't envy you as you try to tackle some of these challenges. However, I would ask that you do continue to support policies that allow us to help patients and expand jobs for Americans. Some of the things that are critically important to us include policies around access to educated workforce, and Pete also alluded to this. Highly skilled talent is very, very important to us. We really rely on the academic community and the new biotechs as a source of new innovation for us, and as a source of new ideas, new biology, new science. We look for consistent, predictable, and stable tax policies. Because when we do invest for the long term, and we want to make sure that we have some ability to predict what the tax situation will be like in the long term. Policies that embrace foreign-owned corporations, as you can see, even though we're a German-based company, we have a significant level of job creation here in the U.S. and intend to continue that in the future as long as the climate that supports innovation is still there. Quality of life is very important to our employees. a stable and a highly skilled education platform for K through 12 education for our employees' children is highly important to us. So I often start a presentation by saying that I'm one of the luckiest people in the world because I get to do what I love and I'm very passionate about. I'm a scientist by training, and I've worked in this field for more than 20 years, and I can tell you there's no greater reward than a patient telling you that he or she has been helped by one of your drugs. And this kind of feedback and this kind of success really drives our passion to continue to develop even better treatments. And my experience is that the entrepreneurial creative spirit is very alive and very well in every state in this country. And I believe that it's that creative energy that is going to help us through some of the difficult challenges, especially in healthcare, that we face in the future. So we ask that you continue to support the policies that allow innovation to flourish and allow us to be successful in the future. And with that, I'll turn it back over to Deb.
Thank you very much. That was an interesting presentation and gives us some insight into issues within the pharmaceutical industry. Finally, we have with us today Chad Cornell. He is with Medtronic Incorporated. In January of 2009, he was appointed Vice President for Medtronic Business Development. In this role, he's responsible for oversight and coordination of Medtronic mergers and acquisitions, licensing, and minority investment activity. He's been at Medtronic since 2003 in various roles, but always concentrating in strategic transactions and corporate development. Prior to joining Medtronic in 2003, Chad spent 5 years as an associate attorney in Chicago working on mergers, acquisitions, and security offerings through Sidley and Austin. So now we'll hear from Chad.
Thank you, Deborah, and thank you for the opportunity to speak today. As you mentioned, as the previous speakers mentioned, we all work in this area, and the policies that we encounter in our day-to-day jobs are very important to what we do. So it's really a great opportunity for us to sort of make our case. As you mentioned, I'm at Medtronic. I oversee the acquisition activity as well as the investing activity we do. And that's one thing I'd point out at Medtronic and many of our competitors in the medical device space. It's very common for us to invest in startup companies. And so in what I do and many of our competitors, we're not only, acquiring large established companies, we're also spending a lot of time and making significant financial investments in small startup companies. And that allows us to really see the import and the impact that state policies and government policies generally have on startups, on small companies, and at the employees at those companies. A lot of what I will talk about here will sort of build on or punctuate what Peter and Christine already discussed. I'll lead off with just a bit about Medtronic and about the medical device industry, which is obviously, there's a lot of similarities with the pharmaceutical and biotech industries, but there are some differences. And then I'll spend a little more time on just some of the trends, at least we're seeing at Medtronic in the device industry. And a lot of these are not just therapy trends, it's more the impact of data and information, the convergence between medical devices and some other healthcare industries. And so I'll touch on a number of those things. And then last, I will speak specifically to some of the factors that we see is really essential in terms of driving innovation in the industry. So next slide, please. Okay, so this is just a snapshot of the medical technology industry. Really, sometimes we refer to that synonymously with medical devices. It really is an American success story, as we have on the slide. the industry has grown up and sort of been germinated by the work that physicians do and that engineers do in university and clinical settings. A lot of companies like Medtronic started out very small in an inventor's garage and have really built an entire industry. As Christine mentioned, there is sort of a multiplier effect, at least we certainly see it in medical devices. The job one company in medical technology provides will then spurn additional employment and additional jobs, and it feeds an entire ecosystem between patients and providers and government and companies as well. And at the bottom page, the last bullet point, there are a few states where medical devices still are more of a focus, I'd say, or at least there's currently more activity. California, in large part due to the venture capital industry and the place at Stanford University, especially, as well as the northern San Francisco and some of the other universities have played. Minnesota, Massachusetts, Pennsylvania, and Florida are also leading med tech states. That is changing, though, I'd say, not only nationally but internationally. The world is flattening, as some of the other speakers mentioned. The environment is becoming more and more competitive. Foreign countries are trying to lure additional medical technology investment, and so we see in the upcoming years more of a competitive environment, and both nationally and internationally. I would also add that innovation in medical devices, though it is becoming more competitive, the U.S. is still the market that global multinational companies aspire to, at least in medical devices. So we are, I think, one of the few industries, or at least one of the industries, that is typically a net exporter for the U.S. We are exporting ideas, jobs, products, and contributing to a positive trade balance. It's becoming more competitive, but that is certainly today, that is still the situation. Next slide, please. So as I mentioned briefly, Medtronic is sort of the paradigmatic, garage company founded in a garage story. A man named Earl Bakken around 60 years ago, and one other gentleman founded the company in their garage in Minnesota, and worked with physicians at the University of Minnesota to develop the first pacemaker. And obviously from there, the company has gone on to bigger and better things. Next slide, please. So here's just a snapshot of Medtronic overall. We have approximately 40,000 employees, and I'll break that down in a couple slides as to where they're located globally. But we're a global company with 120 located in 120 countries. A number of manufacturing facilities that are globally placed, in a number of R&D centers. We currently generate around $16 billion a year in revenue. We like to measure our progress by how often our products are touching or affecting a patient's lives. And we're now down to every 4 seconds. We've calculated that our products are somehow improving or enhancing someone's life. Next slide, please. So Medtronic works in a number of therapeutic areas, and this is just a snapshot of our different businesses. As I mentioned, our revenue is around $16 billion, roughly evenly distributed between these businesses. I'd say our focus is still, as a company, has been on the cardiovascular side. So in the upper left-hand corner, you see a variety of devices that treat cardiac rhythm abnormalities, pacemakers, sensing devices, things like that. On the upper right, there are a few pictures of different cardiovascular devices, things like drug-eluting stents and heart valves. We have a large business in neuromodulation to treat neuro diseases, central nervous system diseases like Parkinson's, and dystonia, and some very cutting-edge therapies, hopefully in the future, to treat things like Alzheimer's. We have a large business treating diabetes, a growing global epidemic, both type 1 and type 2 diabetics. And then last, we have businesses that develop products for just general surgical procedures, as well as a business that's focused on treating back pain in a variety of ways. And I'd say sort of thematically, the company is focused on treating chronic disease. We've been most focused on implantables to treat those diseases, and we've looked and continue to look for a number of new ways to treat those diseases better and more efficiently. Next slide, please. So now I'm just going to cover briefly a couple of key trends we're seeing, and this impacts the job I do greatly, because this is where the future is, and I suspect this is where policies will need to evolve as well to deal with some of these trends we're seeing. The first is this convergence. We hear that term a lot in a variety of contexts. In medical devices, we talk about the convergence or integration of medical devices along with information technology and along with biologics or pharmaceuticals. So, for example, drug-eluting stents have become the standard of care for atherosclerotic disease, a combination of a piece of highly engineered metal, a stent, and a drug, and that's implanted in someone's vessels when their arteries in their heart become clogged. That's an example of a convergence between a device and a pharmaceutical. Stem cells and proteins and different biologics are increasingly being used for different diseases, but you need to deliver them often in very specific targeted ways. And so we're working, a lot of the venture investing we're doing are working with biotech companies actually on delivering their biologic to a particular place. One, I think, misconception out there, certainly in the lay press at least, is healthcare and innovation often leads to higher costs. And no doubt many of these therapies are expensive initially because it costs a lot of money and is very risky to develop them. But a lot of where the future is on treating disease more efficiently and more cost effectively. And so it's not just about increasing cost to the system, it's about keeping people out of the hospital and making it easier for the providers and the payers to effectively manage chronic disease. Next slide, please. And this next slide really speaks to that. The convergence of data and informatics with therapies is really a hot topic. I can tell you this is where a lot of the leading venture capital firms in the world are starting to make bets on healthcare. It's something we're all in the device industry thinking about. How can we allow and facilitate our devices to talk with payers and providers and patients to better manage their disease. Heart failure is one of heart failure and diabetes, I'd say, are sort of two of the most common disease areas where folks are looking at this. Heart failure, which is the buildup, can lead to the buildup of fluid in a patient's lungs, accounts for a disproportionate part of hospital admissions in the U.S. If we could just keep people with heart failure out of the hospital, it would save the system a tremendous amount of money. So if we can find ways for a physician to be alerted to if a patient is seeing fluid buildup, if they could get in touch with their physician before there's a problem and prevent or delay at least a trip to the hospital, that could save the system a lot of costs. And so those are the types of things we're trying to look out in the future and develop more. Next slide, please. And then, I mentioned the convergence of drug and biologics, and I mentioned drug-coated stents. I think diabetes is the other chronic disease that is just mushrooming globally, in large part to the lifestyle and dietary habits of people and patients. And again, an area where we think we have therapies where we can moderate insulin production or help augment insulin production, as well as measure glucose levels, and then transmit that data to payers, to patients. A lot of these technologies are increasingly being directed at kids, so making sure parents understand what their child's glucose level is, are they low or high, etc. And so that is where a lot of our focus as a company is going. Next slide, please. In the last slide, again, and I mentioned this, but I want to punctuate it a bit more, is making procedures better, more efficient, easier for physicians. One way to do that is to make them less invasive. Patients love it. Their recovery time is faster. There's less scarring. Hopefully there's lower risk. For physicians, they end up with happier patients, and again, hopefully they're lowering the comorbidity risks of a procedure. And again, a lot of the investment in the future of healthcare is going into these areas, taking established procedures and making them less invasive for patients. Next slide, please. Okay, so now I'll just give a little more of a sense of where Medtronic's located, and then talk specifically about some of the factors that at least we think are important in terms of fostering innovation. So this slide shows the states of major presence for Medtronic, and as I mentioned before, we have around 40,000 employees globally. Around 25,000 of those are in the U.S. So over half, and I'd say that sort of correlates with our revenue. Around, of the $16 billion revenue we generate, around 60% of that is in the U.S. Our major operations are in Minneapolis, or Minnesota rather, California, and Tennessee, but we have an increasing presence in a number of other states, which I've noted here. And then we also have quite a large manufacturing presence in Puerto Rico, which is not on the slide here. Next slide, please. So in terms of factors that we think drive expansion or innovation, I've tried to lay out a number of them here. In truth, it's a combination. It's a variety of things. It depends on the therapy or the type of business. But when we look either at an acquisition or a startup, we think in terms of the total cost of doing business in a particular region. And in part, that literally means cost, financial, what are the implications. But it also includes the qualitative factors that go into determining whether a business is going to thrive in a particular area. The workforce, the availability and quality is obviously key. When you look at, I mentioned that earlier that Minnesota, California, and Massachusetts are hubs for healthcare. You may ask why. Well, in part, certainly in Minnesota and Massachusetts, it's because you have such a prominent and progressive healthcare provider system. Some of the leading hospitals are in those areas, and they've spawned leading universities and thought leaders, and those in turn spawn leading engineers, and it's really an ecosystem. It's symbiotic, and that feeds on itself. And that is a goal of any startup. You want to locate your company where you're going to be able to find qualified workers. Tax structure and incentives, that speaks for itself, and I know you're all under tremendous pressure in your states with a lot of confounding and conflicting goals. R&D credits, dollars count to these young startups as well as to large companies. And to the extent you can make yourself competitive, it's only going to help. This industry, like all industries, are becoming global, and the U.S. is buffeted by a number of unique circumstances, but it is an increasingly globally competitive environment, and taxes and incentives do matter to both companies large and small. The regulatory climate, again, this is very important. Again, for small entrepreneurs, where are they going to hang out their shingle, as well as where a large company like Medtronic would locate itself. How easy is it to do business? How easy is it to conduct R&D? Some states I know have adopted one-window philosophies where no company should have to visit more than one governmental agency. I mean, that is the kind of thing that is attractive to entrepreneurs. Access to research universities, again, I mentioned this earlier. This is really key in an industry like medical devices, and I suspect in all healthcare industries, because at the end of the day, it's a business that's grounded in cooperation with physicians, with providers, at least medical devices. And so access to thought leaders and leading universities and healthcare centers is absolutely essential. Quality of life, it goes without saying. People want to work in places where they like to live. And then I put the MedTech cluster. I suppose this is in part redundant with my comments on workforce, but it is really a symbiotic industry, and so it feeds on itself. To the extent you can attract some companies and start to build to see some activity, it will build on itself. And then last is infrastructure. Again, goes without saying, but for some of our business, our spine business, for spinal procedures, you need to ship a variety of devices to a particular physician on the day of a procedure or the day before, because once the physician gets into someone's spine, they're not sure what exactly they'll need in terms of instrumentation or implants. And so we located our spine business next to the FedEx headquarters in Tennessee. I'm not sure that was the only reason, but if we were to locate it somewhere else, we'd have to be absolutely certain that there's a reliable business delivery system that can accommodate, getting our devices and implants to physicians when we need them to. So that is really all I have, Deborah. I, again, want to thank everybody for giving me the opportunity to sort of make our case, and hopefully this was helpful.
Thank you very much. Now we're going to move on to listener questions. As I said earlier, that you can type your question directly into the box in the GoToMeeting control panel, or you can email your questions directly to us at questions@csg.org. And as we're waiting for a couple of questions to come in, one thing that has occurred to me as I listened to Pete, and others of you may know as well, is you talked about states becoming involved in venture capital and angel funding. I wondered, I read a little about the Connecticut venture into that and how they've actually captured back money from their investments, that their investments have produced income, and that now the state is able to use that income to further invest in other companies. Is that frequent, or is it usually a one-way street from state government to the companies in terms of that capital formation?
Sure. Well, I could start the conversation. When the industry and policymakers and universities to some extent began this pooling of money to support industry startups, basically, get them out of the valley of death, in particular the emerging companies and very early testing companies. The states that did this in the beginning were really going into the conversation not knowing what was going to be happening at the end of the tunnel, and so I think probably 10 years ago there was some money going in, uncertain about whether the money was going to be coming back out, and probably a few challenges. I think what's happened in certainly the last 5 years, the state governments in particular, several in Connecticut, several good examples in North Carolina, great examples in Massachusetts, Illinois, and others, is that the the folks from state government hired basically a group of portfolio management group who knew the subject matter very, very well, and who made some very good decisions on placement of money to startups. I think the level of professional, knowledgeable folks in place to help place that money really has made a big difference in a number of states. I think that there are going to be more once there's a little more cash flow in the next couple of years, hopefully, for the industry or for the general economy. And I think we're going to find more and more expertise and expectations by state governments to the folks that they hire on to do the placement work. And again, I think great science gets funded. And I think more and more that's the case. And I think that that's attractive not only to venture funders, but eventually to companies themselves who see this kind of better flow of information, better flow of opportunities.
Chad, do you or Christine have any comments on that question?
This is Chad. I would say I definitely, when we do a lot of our investing, talk to entrepreneurs, many of whom will look at state funding as a vehicle. So this would be direct state funding into the company. And then the venture funds, as Peter said, some states have been quite active investing in venture funds. Others haven't. Venture as an industry has gone through some tough times recently, with more a byproduct of some of the general economic issues that the country has faced. If I were a state policymaker, though, I absolutely would think about ways you can participate in the upside that that some of these companies hopefully enjoy. I know Minnesota, for example, has taken equity positions in startups. It's also through tech transfer and things like that come up with some innovative ideas, whether it's a royalty or just participating somehow in the economics if a product or a therapy comes to fruition. But there are a number of ways to do that. I think I just urge people to think creatively, because when you're a young company, you just want to get going. You want to be able to pay your employees and keep the lights on. You're going to be more willing to, if you end up being successful, to allow your investors and early backers to be successful. So it's usually, it can be a sort of a win-win conversation for both sides.
But I think everyone needs to realize it is risk capital, and a realistic understanding that great science does not all the time translate or more eventually into a commercial product that can be put on the marketplace. The cohort of investors, public officials involved and interested in this certainly have to be up to speed on current trends and direction of where the money flow is happening.
Yeah, agreed. I would add just a couple of comments from the big pharma side. I think that even a lot of pharmaceutical companies now have corporate venture funds as well, and invest in the ways that you're talking about. And I think there's certainly the potential for returns there. It is risky, but I think there has to be a commitment to get into this for the long haul. It's something that doesn't necessarily yield fruit right away. But I also think that even in the venture world, there are a lot of, as Chad mentioned, a lot of really creative ways of being able to provide funding to small companies and to academic startups that I think states could learn a little bit about how that's done by watching some of the venture world right now and what's happening there.
Okay, thank you very much. On another piece of interest, particularly to our members, we hear, and each of you addressed a little bit, the idea of tax incentives and the tax structure in states as a consideration for companies, whether small startups or large companies, as two of you represent. And could you talk a little more about the importance of that? Christine specifically said that one of the interests of her company was a consistent, predictable, stable tax policy that, at least to my ears, sounds a little different than the lowest tax policy in the country. And could you just talk a little bit about how that fits into the equation? I think sometimes lawmakers are sort of or sometimes are presented that that's one of the biggest things they have to do. So help us kind of weigh that piece.
Well, Christine, you want to weigh in first, or?
You can go ahead.
Well, first I want to go off a little bit to the left, 3 degrees off starboard here. This is a very expensive industry. This is a very patient industry in terms of how other people see the research, development, and commercialization. I always use, when people ask me why does it cost so much early on in the process for a life sciences company, and in particular a biotech or pharmaceutical or med device company, to start operations? Picture yourself and everyone in the on the call that you're in a room and you clear the room out, and you bring in. You're going to start a software company, and you're going to bring in desks, computers, people. You're going to spend 6 months. Develop a piece of software, license it, and clear the room 6 months later or a year later. With a life sciences company, it's just the opposite. There are so many agencies that oversee all phases of a company's introduction into research and testing. You have the EPA, you have the FDA. You have state agencies, etc. It's a tremendous amount of money to get a company to locate a physical structure and all of the equipment and people necessary just to start out. So by and large, the industry, particularly startup companies and all companies, are looking for stability in the relationship because they're making an assumption that they're going to be in it for the long haul. They want consistency from their partners, and particularly policymakers or regulators, or not just at a state level, but also at a local level, to be conscientious partners with them, and that they understand, and that these partners understand that it is a long-term view that everyone needs to have at the table when they start out. So yes, absolutely, these companies need to have a stable environment, regulatory tax environment that is not going to change, overnight, and if things change, that they're incremental as opposed to as dramatic. So we have a number of examples of where that, again, I think if you look at the clustering of where this industry is most successful, it's a knowledgeable group of policymakers and industry working together to identify where the common values are and understanding each other's priorities, including industries, which requires a patient period of time to be able to be successful, and a group of policymakers who understand that.
Yeah, so I can elaborate just a little bit, reiterating that certainly, when a corporation such as ours invests, we've talked about this already, that we invest for the long term. So, we think of our strategic plan as being along the 5 to 10 year horizon, and so the need to have a stable tax environment, I think, is critical to induce that investment. More specifically, I think things that encourage investment are those that involve new tax credits based on new activities like R&D, grants from economic development agencies that provide tax credits based on our commitment to invest. Things like that are things that we would look for.
I could actually give you probably 5 or 6 right off the top things that off the top of my head, things that could be that a state can do to support the long-term view of an industry, assuming all things being equal. A number of states have capital gains tax cuts for targeted at corporations, institutions, and individuals who do venture capital investments. Another one's net operating losses. And some states have 15 years, some have 8, some have 20 years to be able to offset against future taxable income. Certain kinds of tax exemptions, biotech sales and use tax exemptions for the purchase of equipment, etc. Those are 4 right there that I think helps a company see that state government and policymakers understand the long-term nature of product development for our industry. So those are a few right off the top.
Okay, I think those lists are always very helpful to our members.
Well, I'll make sure we provide that in the paper, the report I provide to everyone.
Sure, thank you very much. If our audience wants to learn more about your industries, about supporting economic development, formulating policy that helps the industry, where should they go to read or learn more? What are your recommendations?
This is Chad. I'd say for medical devices, AdvaMed is the industry organization that Medtronic and most other large device companies are members of. So advamed.org is a good place to start.
We also bio.org is for the biotech sector, but also the Biotechnology Industry Organization has 50 affiliate state organizations in 47 states. And I would think that those on the call, if you would get on the internet and Google biotechnology organization in your state, you'd probably pick up on that organization. We do a lot of work with them, provide them lots of information. Their website can provide not only information and links to national resources, but our affiliates absolutely have great connectivity with state resources. So I certainly would go to those 2 sources to help out. The other one, again, if we're talking about, if we didn't get too much into the clustering effect, but if someone's interested in that aspect, Michael Porter at Harvard would certainly, Googling him would certainly provide a plethora of detail